Welcome to the Healthy Heart Show, where we pull back the curtain on conventional medicine and dive into the root causes of cardiovascular health. If you are concerned about high cholesterol, high blood pressure, heart attacks, stroke, or atrial fibrillation, this is the place for you. We will provide natural heart information that will help you prevent, treat, and reverse any ailment, leaving pills and procedures out of the picture. Here are your guides to holistic heart health, board-certified cardiologist and Amazon best-selling author, Dr. Jack Wolfson, and natural heart doctor, naturopathic physician, Dr. Lauren Latanza.
Hello, fellow cardiac longevists. Welcome to the Healthy Heart Show, where we discuss how to live your best life without pharmaceuticals and surgeries. I am board-certified cardiologist, Dr. Jack Wolfson, and I want to support your 100-year heart. So that's the focus of the show, about how you can live your best life, your longest life. Again, trying to get off the pharmaceuticals, trying to minimize surgical procedures, always going after the cause of cardiovascular disease. And when it comes to cause, again, there is so many different things we could talk about, but today we're going to focus on certainly a topic that a lot of you may be unfamiliar with, but I think you really need to know about, and that's why I have the perfect guest for you. I've got Dr. J. Davidson on the show today. Dr. J is a two-time #1 international best-selling author and was the host of summits, which if they're still available, and Dr. J will tell us about this, all this information and all the experts that Dr. J put together, chronic Lyme disease summits, the parasite summit, the viral and retroviral summits, the mitochondrial summit, and he's also the co-founder, along with Dr. Todd Watts, of the practitioner supplement line, CellCore Biosciences. So these are some of the best products in the world, and we're going to talk about CellCore as we go along here, and again, dive into some of Dr. J's experiences with that. So, Dr. J, how you doing, buddy?
I am awesome, Jack. Good to be here.
Fantastic to have you on. I appreciate you taking the time. And again, I first heard about you from the Lyme disease summit from a few years back, and that was kind of like when summits were just really rolling out, and now it seems like there's a ton of great information out there, but you were one of the first people to come to market. How'd that all come about as far as creating all that stuff? Where did you find the need to create with chronic Lyme, and where'd you go from there?
Well, it definitely came from desperation of helping my wife. So my wife gave birth to our daughter about 9 years ago, actually now, and the bottom just fell out. She had to stop breastfeeding. I mean, her body was just inflamed, shutting down. She couldn't eat any foods. She ended up water fasting and drinking just the traditional bone broth for about 17 days, because anything else, she'd put, spinach in her mouth and she'd start flaring up. It would just cause massive inflammation. So she dropped about 40 pounds in that short time, which was not recommended, but just her body was in this, crazy, really acute state. I mean, she nearly died again. She almost died when she was 7 years old, in a coma for 6 weeks from Lyme and other things when she was little. And then when she had our daughter, it basically reappeared. And so it shifted my focus. And I started getting more into the, considered maybe natural medicine, functional medicine realm. I was very geared of structural correction, chiropractic. And then it's just like, okay, what do we need to do to save my wife? And so I just became obsessed in that area. And then I was actually at a conference speaking, and one morning I just woke up dead from a sleep at 4 a.m. sat up in chronic Lyme disease summit. I'm like, where did that come from? And I basically hosted the Lyme disease summit back in, I think, 2015. And that just kind of kicked off, bringing on experts in different areas and, extracting information to bring it to the public. And yeah, summits became more and more popular. So it's been quite a journey.
Yeah, and I think those of us physicians, we all kind of have that origin story, or maybe multiple origin stories, but some of the best holistic and integrative doctors, again, either they suffered the health consequences themselves, or was because of a loved one, and typically a spouse or maybe a child, and that got them into a certain health arena. And your focus back then was on Lyme, and I think, if I correct me if I'm wrong, that it's really kind of obviously expanded a lot more, because it's not just Lyme. And if I were to make this statement, tell me what you think, that so much of what we thought was Lyme is is either not Lyme and it's all related to the concept of maybe water damaged buildings, indoor air quality, or is it that this indoor air quality, water damaged buildings just is so deleterious to our immune system? So now it allows some of these chronic infections to really fester and now lead to symptomatic illness.
Yeah, my thoughts now are different than they were 4, 5, 6. I mean, even 8, 10 years ago. It's amazing. As I look at what really brings people's health down, I believe it's primarily toxins. It's toxicants. So toxins are more of the chemicals or the byproducts that, organisms like mold will produce, mycotoxins, and then toxicants are technically more of the, man-made chemicals. As I look at the Lyme space, I mean, it's interesting when you look at Dr. Stephanie Seneff's work and she charts, glyphosate use and all these different conditions increasing and, words that we have to be careful in saying before we get banned, diagnoses. Well, Lyme is also in that. And it's amazing when you test Lyme, you'll find glyphosate nearly in that area almost every time. So it's like, what comes first? And as I look at it, I think something that's really interesting, I know we're going to talk primarily on mold and mycotoxins, but is to look at pleomorphism and what causes a, commensal bug or a good bug to go bad. And it's usually a poison, it's a toxin. And so Lyme disease, I believe one of the things that brought my wife down looking back at it, as we thought it was Lyme, and it was definitely a Lyme flare up. I mean, it came back laboratory, it was acute, all that. But I think a lot of it was there was mold exposure and it was her drinking water. She was drinking chemicals and radioactive elements that was suppressing the immune system, suppressing mitochondria, and just not allowing her body to function. So it's so easy to get caught on, let's kill that bug. But we just need to go to that next level of what's causing the bug. And usually it's a poison, it's usually a toxin. And, water damage building creates mold create mycotoxins. That's a poison to us and we get sick.
Yeah, and for those people who are listening, obviously, whether you're watching the video or you're listening to the podcast, this really is for you, because no matter what your cardiovascular issue is, you need to know about the stuff that Dr. J and I are talking about right now, because you may not have obvious symptoms, and maybe I'll have Dr. J break down what those symptoms are in a second. You may not have obvious symptoms that you know of, but if you're suffering from atrial fibrillation, high blood pressure, cardiomyopathy, coronary artery disease, had a heart attack or a stroke or stent or bypass surgery, if you're one of the tens of millions of people out there with cardiovascular issues, and it's the number one leading killer, you need to know about this, because this is how you're going to survive, by learning this information and really assimilating all the stuff we're talking about. So let me circle back, Dr. J, and let's talk about some of those symptoms of, like you said, of toxins, of toxicants on a bigger level. And then maybe we'll dive down into this concept of water damaged buildings and the actual big offender there, the mold mycotoxins.
Yeah, and I know I talk a lot about my wife's past with Lyme disease and it being a big shift, but honestly, she had tons of heart issues. She had was diagnosed supraventricular tachycardia and went in for an ablation, and then was skiing. This is when she was 18 years old, skiing after that ablation, and then her heart took off racing. She passed out and ended up at the bottom of Black Diamond somehow. And went in for another surgery. So her heart has definitely been an area, and anytime it flips, flops, flutters, it just, emotionally is like, whew, there's so much tension there. So the heart with her was a big thing too. So as far as symptoms, so it's just diving into mold real kind of stepping back for a second. Mold is not usually what actually makes us sick. It's the chemical or the toxin that mold produces. And the reason mold does this is basically to shunt and to take down all of the other microbes in the environment. It wants to run the show. Well, by running the show, it's producing this toxin called a mycotoxin, and that's what we get sick from. That's what we react from. So it's not only taking down other microbes and pathogens in the environment, as mold wants to be the king or queen of the environment, but it's also going to affect us. And there's all kinds of symptoms that can come up from mold. Generally, it can happen just with a family member or two. And what happens is it shows up in those that are more susceptible. Those people that like their bodies are firing on all cylinders, things are going well, they're going to be less affected in a mold environment or in a mycotoxin environment, whether it's work or home. It's going to take them generally longer, where other people that are, they've been knocked down with, autoimmune or heart conditions or other things in the past, symptoms are going to show up generally faster. So, and symptoms can range from just brain fog of, you're talking to me and I'm saying, what, can you say that again? Of things just aren't registering. That's a common symptom. Massive fatigue. You can't even get out of bed. Memory things. So lots of brain things, skin, rashing, itching, the pruritus is a big condition. I actually would say heart fluttering and heart palpitation type symptoms, which is obviously in your world, because I really believe it's related to mitochondria. The mitochondria is the powerhouse of the cell. And, the brain is generally the most dense mitochondria rich for an organ. Well, the next one is the heart. So if you start damaging the mitochondria, the organs that require the most mitochondria are going to show first, which is brain, which is heart. So heart obviously is going to affect, everything in your world. The brain's going to be more of the headaches and memory loss and can't process, brain fog, those type of things. Really common though with mold is bloody noses. That I've seen in the past a lot. People are like, oh, I don't, it just starts. It's like, oh man, I literally blew my nose and now I got this, nose that won't stop bleeding. That's a big one. Lung, breathing, asthma, wheezing, just kind of always a phlegm, cough, sinus problems, where you always have like this drainage in your throat, or you feel like you can never clear it out. Those are probably some of the most common symptoms, but it can also affect, obviously in the brain, it can be more of an anxiety, depression type. It can be frequent urination where you're having to, pee 3 times in the middle of the night. You just literally can't hold it. So mold can have lots of symptoms, but those are some of the ones that stand out to me.
Yeah, and I think that when I talk to people, and whether it's on the stage or on video or even in person, or I tell them, no matter what your symptoms are, like think about whatever it is bothering you, understand that it could be mold, and we need to figure this out. And you brought up, especially, for children and all the children's brain issues and developmental issues. How do we know that it's not mold? How do you know it's not mold? You got to figure this out. You talk about, your wife, and of course, I've heard this story so many times. And unfortunately, I've heard this story more times in kind of my previous career as a traditional cardiologist, where the only thing we do is exactly what your wife had. We try pharmaceuticals, we try surgical ablation procedures. And even if that is successful, and they may be, if we never got rid of the cause, someone is still liable to suffer the long-term consequences from it. So that's a major, major problem. And, again, we see so many people, you're right, with all these either strange symptoms or symptoms that everybody seems to have, and we need to really focus in on that mold. So let me know what you think as far as if someone is listening right now and they're suffering from any symptom or any disease, whether it's, again, high blood pressure, cholesterol, maybe they were told they had Parkinson's, maybe they are having these cognitive issues, how should people go about finding out if they are toxic in these mold mycotoxins?
So there's different things. And one symptom that just popped up in my head too, that I want to mention is the light sensitivity, sound sensitivity, EMF sensitivity. Like if you're in that category, smell, a perfume cologne just knocks you out when you smell it with somebody. If you're in that sensitive category, pretty classic for mold. I would definitely just hone in, like mold is probably a big thing. So besides looking at symptoms, and, going through history, has there been water damage in your house? What was done to remediate it? All that environmental, I would say, analysis. Really, when you look at the body, you can run a lab test and you can see, are you clearing out any mycotoxins? Are there any mycotoxins in you? And it's not a guarantee that if you come up with mycotoxins in a lab test that you're exposed to it in your environment. Is potential that you could have ingested it food wise, but I would say it's a lot more common where it's actually your house you're living in or the work you're working in, or if you're in school. I mean, school buildings are notorious for just tons of mold and water damage. A lot of, public facilities, government buildings, like just classic for that. So I really like running laboratory testing. Originally it was real-time labs. Then Great Plains Labs came out with a mycotoxin panel. Now it seems that Vibrant Wellness or Vibrant America seems to be, give you the most data, the most different types of mycotoxins. And it's, you can check to see what comes out of your body, urine. Usually laboratory analysis is going to be urine or it's going to be blood. And basically, if any mycotoxins come up in that, that's an exposure. And to rule out, well, is this just something I ate or is this really more in my environment, is you can also check family members. And if family members come up with the exact same types of mycotoxins, you can pretty much hone in that it's probably the house you're living in. And then you can start going down that, well, where is it in the house, and getting somebody to professionally, remediate it, because you can actually make the situation worse just by opening a wall up if there is mold in that category.
The Healthy Heart Show will be right back after we take this quick break to hear from our sponsor. Would you like to drink great tasting coffee that's also good for your heart health? Cardiology Coffee is your answer. This 5-star rated coffee is delicious. It's a gourmet coffee that begins with whole organic beans, hand-selected and carefully roasted. It's tested and certified to be free of pesticides, mold, and other toxins. Cardiology Coffee is great for your heart, and you're going to love how it tastes. Order now online at cardiologycoffee.com. Now back to the Healthy Heart Show.
Yeah, most certainly, hiring a mold inspector, and sometimes it's easier to test for it these days, and it may be easier to treat the person, right, than home remediation, which is a whole nother issue. And I'll save that for another episode because that deserves a lot of time. But, again, because the traditional cardiologists do not understand this, doesn't mean it's not true and it's not a problem, because all these things, right, Dr. J, that you and I are talking about, this is all in the medical literature. If we look up mycotoxins and XYZ disease, we're going to find it in the medical literature very often. Now, there's not a lot of money in the research on this compared to pharmaceuticals, obviously. But we need to get people to understand that no matter what their health issue is, that it could be a mold mycotoxin issue. And we do use a lot of Vibrant Wellness in our program. It's a real simple, easy urinary test. Looks for 31 different mold mycotoxins, either coming from the environment or coming from the food. And then now, once you get that information, yes, we need to get into quality remediation. That is numbers 1, 2, and 3 as far as importance. But then, of course, now how do we work to get these toxins out of our body? And I think that's really what your passion is right now, for a lot of different toxins, and we can talk about that. But maybe let's talk about your company, CellCore Biosciences, and let's talk about what led you and Dr. Todd and the team to start CellCore.
Yeah, well, it was definitely, I would say, not the traditional way you start a company. I became friends with Dr. Todd Watts. I was actually speaking at a seminar and speaking on Lyme disease and hormones, actually. And some guy at the end asked a question, and it was, a tough question. And then another question followed. And I'm like, wow, this guy's either a jerk or he's really smart. He wants to know like what's going on. Yeah, or both. Well, at the end, afterward, he came up to me, and it just so happened to be Dr. Todd Watts. And I was like, oh, God, this guy's got a big heart. He just really wants to know and understands biochemistry to a whole nother level. And so we became friends. And over the time, he was working with this thing called Mimosa pudica seed. And it was really sticky. So he's having it hand encapsulated at a compound pharmacist. He was using it clinically. And I was like, man, this stuff it changed my life. I cleared worms out of me and just changed my Lyme disease practice. And so we became friends, and he was pursuing, starting a supplement line to launch this, Para 1 Mimosa pudica seed. And I actually tried to talk him out of it. I'm like, you don't want to deal with the regulations, what you can and can't say and all that. Well, luckily he didn't listen to me. And then we're at another conference, and my brother, my wife was there, Todd's wife was there, and then my brother-in-law happened to be there. And just one evening, we're sitting around the table, and my brother-in-law, he's like, why don't you start a company with Todd and come out with some better parasite stuff, for the world? And I was like, that's a good idea. And Todd said, that's a good idea. And so that's actually how CellCore Biosciences, came about, was us partnering together in that manner. But what I didn't realize was that Todd knew scientists that create stuff that's natural that nobody else has. And so we have about 8 scientists that we currently work with in the area of carbon technology. So we're really the, pioneers in this area. And essentially what it is as you look at your body, we are 96% carbon, hydrogen, oxygen, and just a little bit of nitrogen. So primarily our body's made out of carbon, hydrogen, oxygen. And so the carbon technology is based on natural, extracts of fulvic and humic acids. We extract certain pieces and we'll amplify those essentially, but those are composed primarily of carbon, hydrogen, and oxygen. So it's basically like we're taking the backbone of what our body is made out of. Whereas you look more in the pharmaceutical realm, they'll almost always attach a molecule or chemical that they, make or whatever to a salt molecule. And it's like, well, for carbon, hydrogen, oxygen, why aren't we taking things that are based on carbon, hydrogen, oxygen? And so this carbon technology just really is a game changer in the supplement industry because it's designed primarily to help protect and deliver the herbs. So if we swallow a capsule, let's say we're taking an adrenal supplement and there's a bunch of herbs in there, a lot of them are going to get torn apart in the stomach acid. Well, the carbon technology with CellCore Biosciences helps to actually protect and buffer that through the stomach acid and the different environmental changes to get it into the small intestine so it can actually be absorbed, so it's not denatured, so we can get more of the product to where it needs to go. And then just because of the size and the energy, these are high energy molecules. The energy drives them into the cells, across the blood-brain barrier, but then also because of the size will also assist in it. So it's always about, is the molecule small enough to get to where it needs to go? And then is there enough energy for it too? Because it's one thing to take a Petri dish and it's like, oh, this molecule binds to this toxin when I set it right on top in a Petri dish. It's another thing where it's like that product made it through the stomach acid, got absorbed in the small intestine, had energy to get into the cells, bind on to what it needed to, and then had energy to get back out. And that's a whole different ballgame.
Right. No, and that's what I love about, what you guys are doing. I'm so impressed, obviously, by your team, of the scientists, the research you're doing the things that other supplement companies are not doing. And again, there's a million different supplement companies that are out there. And again, a lot of them are delivering very good products, but I think you guys are really going to that next step. And that's why, everyone on my side, my health coaches, my doctors, everybody at Natural Heart Doctor, we're really gravitating towards your products. And that's frankly why my family is currently doing your foundation protocol. And the foundation protocol, again, I mean, it's just so well packaged the way it is. There's 4 boxes that come like this. And it's a 4-month program of what we do. So maybe I'll let you kind of talk about some of the things that are inside of this program and what we're doing. And again, so for month 1, again, it's very easily done. It's very well explained. It's well packaged to be able to share that message of how it is, again, easy and the process of how we're doing this. But again, certain things that you have in here, you've got the bowel mover, and you've got biotoxin binder, advanced TUDCA, and then you've got a product called CT Minerals, and this is in a glass bottle again. So maybe if you would, and this is just month 1, so we don't have to go through the whole 4-month program. Again, I think this is really just so foundational, which is why you called it foundational. Maybe describe why the foundational, and then tell me the importance of what I think maybe the first thing you do that you guys address is to make sure that these outlets, these pathways are moving in the body.
Yeah. So really our products have been birthed from a need that we've seen clinically, over the years, and from other clinicians and us, just Dr. Todd, myself, working with clients. And the big thing that I noticed with a lot of people that are chronically ill is they have poor drainage pathways and their mitochondria are just blown out. There's no cell energy. And so drainage is different than detox. Detox, I think of it's going in, grabbing onto a chemical, pulling it out of the body. Drainage is just the normal pathways that need to move fluids and things throughout the body. So that would be your colon. You just going poop, like, going number 2, that's a drainage pathway. If you're not pooping regularly, that is a pathway clogged up that then backs everything else up in the body, and, inflammation and all kinds of problems can ensue. So drainage, kidneys, the liver bile duct, bile movement is one of the areas that I see most commonly backed up as well too. And there's certain types of mold mycotoxins like triclothacine and gliotoxin that really will like just stop the flow of bile, just like glyphosate will do that as well too. And so opening up drainage is really key to minimizing symptoms. So if somebody goes through a protocol and they're herxing, they start having symptoms, they're like, oh, I can't proceed. It's generally that there's not enough drainage. So if you're trying to kill a pathogen or you're trying to detox a chemical, everything's clogged up. There's nowhere for that debris and things to go. Symptoms occur. So that's why we want to support drainage. The second thing is just mitochondrial energy. And this was kind of the aha for me, working with Dr. Todd Watts and his understanding of biochemistry. I've been such a big fan of drainage for over the years. And one of the things that he said to me, because I was like, well, when the liver's not functioning, we really need to open that bile duct flow up, because if the bile's not flowing, then everything gets backed up actually in the liver. And he said, well, you have to remember that it's the mitochondria that are literally the energy switch to make that organ function. So not just taking, products that move things, but actually taking products that energize the mitochondria to actually, bring the power on in the organs. What is a big game changer. And that's really the goal of phase 1 foundational protocol is let's start beginning to open up the drainage pathways. Let's start supporting mitochondria, building that up, getting the body prepared. And one of the things you'll see in the phases is there's always a binder. And these binders are, the 2.0 binders where you can take them with or without food, which is just a game changer. They're way different than just charcoal or clay. If you just take a charcoal, there's no energy in that. They just stay in the digestive tract. Yes, they can bind some things in the gut, but our binders, like the biotoxin binder, will not only stay, a third of it will stay in the gut, but 2/3 will actually cross into the body and it'll actually go into the cells and start binding onto things. So, but we're big fans of always being on a binder, always supporting, gathering things up, because if you're just moving things or killing things or turning stuff on and you're not kind of sponging up, gathering the toxins that start get float around, then you'll start getting symptoms. So our big focus really heavily is focus with drainage and mitochondrial energy. Always be on a binder, no matter where you're at. Like that's just a good standard. And then as we move forward with the different phases, then we're really working on the gut and different critters and parasites, because actually, mold spores, Dr. Klinghardt, I heard this from years ago, was, mold spores can actually live inside of parasites. Well, parasites are also big sponges for chemicals and toxins. Dr. Alan McDonald, researcher, PhD, found that actually Lyme disease itself can live inside of parasites. And so if you just think of parasites as kind of housing different things and protecting them, toxins and other pathogens, then it really makes sense to address the parasite side early on, if there is any, clean the gut up as you move forward. And so really focus with drainage, mitochondria, taking down what we consider more of the big critters that are housing, protecting other things in the body, and then really focusing on detoxification. Because when it comes down to it, if somebody is, oh, my heart stuff keeps coming back, my Lyme disease keeps coming back, I keep getting sick of, fill the blank in, or this bug, or it's generally that we're missing a chemical or a toxin in the body that has not been addressed or bound with, or we're still getting exposed to it, and or could be both, right? We're not binding onto it or clearing it out, plus we might be still being exposed to it, like living in a moldy building. And as soon as we identify what that is and clear it out, everything changes. So if somebody keeps relapsing, they keep, I keep getting this back every, I get sick every year, this keeps coming back, I keep having Lyme, I keep having Bartonella, Babesia, why do I keep dealing, I'm so sensitive with mold? Just know that there's probably other things going on. And the more that we can just clear out all the chemicals that shouldn't be in the body, the more your life and health are just going to radically change.
Yeah, no, that's all just excellent information. And again, no matter what people may be suffering from out there, whether it is brain fog, neurologic issues, or it is gastrointestinal issues, or it's cardiovascular symptoms, we're always looking for the cause. And I think as we, really are elucidating, there's a lot of different toxins and, as you said, toxicants that are leading to these problems. But what we found really is that when we start off with step 1 of this foundation protocol, it's a great place for just about anyone to start, because you're really supporting people through that process. So if we have someone who has brain fog, for example, or they have palpitations, and we're waiting to get our mold mycotoxin test back, and we're looking for all these different environmental toxins. While we're waiting to get those results back, we'll immediately start them on step one, because like you said, the binders are so critical to binding up all these toxins and toxicants that are coming in. And then again, that liver support, that kidney support, pretty much everything that we're doing, and to make sure all the outflow tracts are open, people start to feel much better pretty quickly very often. Wouldn't you agree?
Yeah. And usually the younger you are, the faster. Like just three weeks ago, I had a 4-year-old, a friend of mine that was like, hey, is there a pediatrician in the area you'd recommend? I'm like, bring her over. Like, what's going on? And I checked her out and I'm like, this looks definitely like mold, 4-year-old, because you and mom have the same symptoms. Like this, I think this was, a house that you just moved from, and now they relocated. And the little 4-year-old, I gave biotoxin binder, and you can open the capsules up. So had her take a half a capsule in a little bit of water. Usually doesn't have much flavor, and you can always mix something in, if you need to disguise the flavor for kids, but took a half a capsule of biotoxin binder, took just a couple drops of the CT minerals, and a couple drops, I think 3 drops of the Mito ATP. And within 48 hours, the fever that she was spiking for the last week and a half went away. Her, lethargy or just not feeling good, like turned around. 48 hours, boom, fine. Kept her on it, for a week, rechecked her. And I was like, wow, how fast it can change really when you get to that core. So it's safe for kids. The longer you've been dealing with it, the more, I would say, beat down the body is, that you've incurred things over your lifetime, then it can take a little bit longer. But really, when you get down to it, the body was designed to heal.
Yeah, and I get those emails often too, and they're like, is there another cardiologist near me, or what can I do about it, about a child and stuff like that? And it's not that there aren't other great practitioners out there, but again, it's tough when you know that you're just about the best at helping that individual person. But it is a blessing the fact you're able to do so and be able to help out people like that, and knowing that most, again, like pediatricians, they will never ever think about that child's environment. They will always, it's just the default of the medical doctor to think about, okay, what is some kind of a medical label that I can put someone on to satisfy like an ICD 10 code or something like that. What's the label I can put on that person? And then what is the pharmacological therapy? And this child that you spoke of, again, that person, she may have wound up on steroids. She may have wound up on some kind of allergy medicine, some kind of psychological, impacting drug, some kind of Adderall or something. I mean, it could have been any numerous number of things when you went right after the cause and it worked. And that's just tremendous. Absolutely tremendous.
And that's really the key, right? When you get to the source, it changes everything. And with what's interesting is, if you find somebody with mold, generally it's the family members that are going to have some effects. And even though, like in this family, some friends, with the 4-year-old daughter, like the dad, well, I've got some sinus congestion, I wouldn't say my energy's great, but he wouldn't have considered him, sick or having any issues. And I actually had him take some hydroxygen with it, which is a liquid that we have. It's stabilized. It's molecular hydrogen, molecular oxygen, in a stabilized thing, and rinse out with it. And he texts me. He's like, "Is this normal?" And I'm gonna, for those people that are, if I can share if you want me to. I just you have to enable it. But basically, there was looks like a worm type thing that came out of his sinuses that was just unbelievable. So
maybe I'll spare people the visual on that,
okay.
although sometimes it can be very stimulating to get people to take a look. But and I think, listen, the foundation protocol, I think, is perfect for so many people. Yet, if you also want some guidance, of course, we've got links in the show notes of some of the practitioners who work with us to be able to guide people through a lot of the CellCore products. But, I want to thank you and Dr. Todd really for going that extra mile, not only to support your wife and everybody else's family and all the people out there who are suffering, that we're going to be able to take this message really to millions of people who are suffering from these problems and just make tremendous, strides. I like to say, Dr. J, that I love when it's like a win-win-win for people. It's a win for the people at CellCore because they're helping people. It's a win, for the doctors that are using CellCore products. It's a win for the patients because they're getting better. Who are the losers in the equation? Again, it's the doctors and the pharmaceutical companies who are not thinking outside of the box, that are not willing to embrace some of these new ideas, new technologies, which are actually old ideas and old technologies. But we're gonna kind of create a losing situation for them, while the people and our patients and our clients, they're all winning. So again, I'll give you a last word on what you want to say.
Yeah, well, kudos to you, Dr. Jack Wolfson, because you have been a very brave man for a while, and it is not easy, and especially the arrows that are being thrown the last couple of years. Like it, kudos to you and everything that you've done along with your wife. I mean, you docs are changing lives and staying on top of the cutting edge things, and so I couldn't recommend anybody better to go to than your clinic and what you guys do clinically with patients and clients and lead them through to get to ultimately the right path, get to the source. And what we need to do is we need to let our decisions in dollars make those choices. When we start buying foods that are more natural and more people do it, the grocery stores take notice, hey, all this artificial junk isn't selling like it used to. We need to have more and more natural things. And we've seen that over the years in grocery stores as they've kind of been making that change and evolution. Well, it's the same thing in the natural realm as well. As we lead forward, get to the problems and solutions, change our lives, then we can help tell others, this is the path. I worked with Dr. Jack's team and they put me on CellCore and it changed their life. Then other people will start getting results and people aren't going into that broken system as much. And then the system starts, being refocused of what it's there for, emergency crisis care, rather than, people thinking that they're going to get healthy in a system that never gets to the source. So keep moving forward, make the best decision for yourself and your family. And more people that do that are really going to change and transform our culture, America, the world, move into more of this, golden age that we're moving into.
I think we are. I'm going to carry that positive message as well. So thank you very much. And thank you again for everything you're doing. I'm Dr. Jack Wolfson, board certified cardiologist. This is another fantastic episode of the Healthy Heart Show. We will catch you on another fantastic episode with another great guest in order to get you to live your best life, your longest life, the 100-year heart. That's our goal. We'll see you next time.
That does it for today's episode. Thanks so much for listening to the Healthy Heart Show. Please help us get the word out by liking and subscribing to our podcast and our Facebook page, Natural Heart Doctor. Please show support for our podcast sponsor, Cardiology Coffee, your resource for organic, antioxidant-rich, mold and pesticide-free coffee shipped straight to your door. Learn more by adding @cardiologycoffee on Instagram and visiting cardiologycoffee.com. This podcast provides materials for information and educational purposes only and should not be considered medical advice. We encourage you to contact your physician for any of the health issues discussed here.